Atongoria a arigitani a mahiũ bũrũri-inĩ moigĩte mũbango wa kũhe mahiũ njanjo nĩ mwega kuona nĩ wa kũrũa na mĩrimũ ya mahiũ.
All the veterinarians know where we source our vaccines, especially in the country. The CEO is here, Kenya Veterinary Vaccine Production Institute, and they are ready to work around the clock to ensure that we get ample supply. And if we have any hitches, for sure, we cannot lack any way of getting supplies to meet our demand for vaccines for vaccination.
Gĩkundi kĩa mandagĩtarĩ a nyamũ makĩaria marĩ kĩgomano-inĩ kĩa mũico wa mwaka moigĩte atĩ itua rĩrĩ nĩ rĩgũteithĩrĩria kũrũa na mĩrimũ na ũgũtabanio kaunti-inĩ ciothe.
To achieve vaccination to that level, it cannot be achieved by government alone. It requires all hands on deck. The veterinary surgeons and the veterinary paraprofessionals to drive this process to achieve that. The ultimate goal is to have freedom, recognition of freedom from FMD with vaccination, and we eradicate PPR.
Oho nĩ mongereire na kuuga atĩ nyamũ nĩ cia bata harĩ ũtonga wa bũrũri na andũ milioni nyingĩ kuona nĩ ithondekaga mĩeke ya mawĩra na nĩ irio kũrĩ andũ aingĩ.
As vets, we think it is long overdue to have the vaccination campaign carried out systematically to ensure that we eradicate some of these diseases that are preventing us from accessing international markets. But we also ask the government to recognize that they have to be truthful to the public. They have to maintain a credibility that allows them to roll out such programs without fear of contradiction from certain quarters.
Negative publicity against this program would definitely hamper our efforts in trying to drive our farmers out of poverty, because livestock is a key sector that can drive a whole nation out of poverty.
Oho mũikarĩri gĩtĩ wa kĩama gĩa Kenya Veterinary Association aigĩte mũbango ũyũ ndũrĩ na ũgwati kũrĩ mahiũ na andũ makorio matige kũregana naguo.
Ningesema ya kwamba wakulima wote wajue hii dawa yenye italetwa itatengenezwa hapa nchini na madaktari wetu ndio watakuwa wanafanya hiyo chanjo. Na kama chairman ya Kenya Veterinary Board ni sisi ndio tunasimamia madaktari wote na tunajua ile dawa italetwa itakuwa ya muhimu kwa wanyama wetu, na kwa hivyo tungehimiza ya kwamba mtuunge mkono na saa zile madaktari wanakuja mjue ni madaktari wote wameajiliwa na Kenya Veterinary Board.
Ngĩribotera Inooro TV, njĩtagwo Irimũ wa Njogu.